Welcome to HealthCast, a production from Lexington Medical Center that focuses on the latest procedures, treatments, and the people behind the exceptional care we provide to patients. No patient wants to hear the words, "You have a brain tumor," and that is why we are exploring the use of GammaTile. It is a newly FDA-approved device that goes in the brain right after the removal of a malignant tumor. It is now being offered here by a team of Lexington Medical Center doctors who are part of the hospital's Brain Tumor Program. Dr. Jonathan Ng, a neurosurgeon with Lexington Brain and Spine Institute, is one of the physicians performing GammaTile therapy.
GammaTile is a form of brachytherapy, and brachytherapy is implantable radiation therapy. So when people think about radiation therapy, usually they're thinking external beam, an external source, or some sort of radiation source that's given to them, which is by far more common. But brachytherapy has certain advantages. GammaTile is a specific type of surgically implantable radiation through these very focused and very precise sources that can be implanted at the end of brain surgery after certain operations.
After removal of the malignant brain tumor, the surgeon immediately places the GammaTiles in the tumor site. Each GammaTile has bioresorbable collagen in it, and embedded inside that collagen are 4 cesium seeds of radiation.
These collagen wafers are designed specifically so the radiation dose stays extremely close to where it's placed. And so that keeps it from having a meaningful dose to the tissues that need to heal outside of the brain.
When using GammaTile, Dr. Ng works in conjunction with other physician specialists under what is called the Brain Tumor Program at Lexington Medical Center.
So the Brain Tumor Program here is a multidisciplinary group of physicians who have a specific interest and expertise in brain tumors and brain tumor treatment, whether it be surgery, medication, radiation, going to sleep for surgery, or hospital recovery.
One of those physicians is Dr. Quillen Davis, a radiation oncologist. He says for certain groups of patients, GammaTile is an advantageous way to deliver radiation.
The GammaTile at this time is used often in patients that have already received other treatments prior to that, such as conventional radiation treatment and/or previous resections and radiosurgery. And that's why in that group of patients that this is a favorable approach to delivering radiation.
It takes about 5 minutes to place the GammaTiles in the brain. Being able to put the radiation source directly where the tumor was is significant to treatment. The GammaTiles deliver 50% of the therapeutic dose within the first 10 days. This fast dosing helps keep any remaining tumor cells from duplicating.
If you look at the data in the use of GammaTile, that even in recurrent cases that there's an 80% or better chance of local control with the use of this technique.
Eventually, the patient's body absorbs the tiles. Only the small titanium sources stay in the body, but they become inactive and are harmless. In addition, while the radiation is active, it is not harmful to others around you.
You're not toxic. You're able to go home to your family. You don't have to worry about this having effects on other people.
And I'm very proud that here at Lexington that we've been able to put that together for the people of the Midlands to have the GammaTile available, because we're one of the few, frankly, in the Southeast at which this procedure can be done. And so it's a real resource for us to have that right here in our own community.
Our lung cancer patients, our breast cancer patients, our kidney patients, and our melanoma patients, and those are the big 4 that go to the brain, are all living considerably longer with breakthroughs in immunotherapy and targeted therapy than they were 10 or 15 years ago. And that increases the likelihood that you are going to have to deal with a brain metastasis. And if that happens, you want to have a multidisciplinary approach to deal with it.
GammaTile is considered a one-and-done complete therapy, allowing patients to go about their lives. And since GammaTile confines radiation to the area of concern and protects the rest of the brain, it limits side effects.
The important thing to remember about the GammaTile and about the treatment for brain tumors in general is that there's great success both in the present and on the horizon for patients with these difficult to treat tumors. And so we always have to maintain hope and work as hard as we can to get the very best results for these patients.
It's no wonder U.S. News & World Report named Lexington Medical Center as the best hospital in the Columbia metro area for the third consecutive year. As an accredited cancer center of excellence, Lexington Medical Center continues to provide world-class care right here at home. To learn more about the advanced treatments performed at Lexington Medical Cancer Center, please visit lexmed.com/cancer. And be sure you hit the like button and subscribe to our channel to get notified of future stories in the HealthCast series.